1,001 questions about the new coronavirus. When it comes to whether you can get COVID-19 twice, or if you become immune to it, there's not a simple answer. In February, reports emerged of a woman in Japan who had been given the all-clear after having COVID-19 but then tested positive for the SARS-CoV-2 virus a second time. There have also been reports of a man in Japan testing positive after being given the all-clear, and anecdotal cases of second positives have emerged from China, too. This has raised fears that people may not develop immunity to the virus. This would mean that, until we have an effective vaccine, we could all experience repeated rounds of infection. But this doesn't necessarily mean that they caught the coronavirus twice. First, during recovery from infection, a person may have very low amounts of the virus remaining in their body, low enough that our tests can't accurately detect it. In this case, the person may be sent home on the assumption that they're virus-free. However, their body may still be fighting the virus, and a resurgence of the virus, and symptoms, can occur, resulting in a positive test. In this case, it would just be one protracted infection, not a reinfection. Second, we know that in most people, SARS-CoV-2 generates a strong response from the immune system. With the related coronavirus SARS-CoV, this response creates an immune memory of the virus that prevents reinfection for 1 to 2 years, and it's likely that this is also the case for the new virus. SARS-CoV-2 also has a fairly low mutation rate, which means that it, hopefully, won't change enough that our immune system no longer remembers. Those who recover from the coronavirus are probably not going to catch it again, at least in the short term, experts say. But it's unclear how long that immunity will last. It is reasonable to predict we will have some immunity. To say you will have lifelong immunity? We just don't know yet, said Francis Lund, professor and chair of the Department of Microbiology at the University of Alabama at Birmingham. But I think it's a reasonable conclusion that you will have immunity for the rest of this season. The key to immunity lies in the antibodies produced by people who have recovered from COVID-19, the disease caused by the coronavirus. Antibodies are proteins in the bloodstream that attack foreign intruders, such as viruses and bacteria. Those produced in response to the coronavirus may one day help guide public health measures, such as signaling when it is safe for a person to end social distancing. They are also being explored as a treatment for critically ill patients whose own antibodies are not enough to fight off the virus. More research is needed in both of those areas, but in the meantime, top health officials have expressed confidence that coronavirus antibodies are likely able to prevent a person who had the infection from getting sick with it a second time. We don't know that for 100% certain because we haven't done the study, Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, told The Daily Show host Trevor Noah last week. But I feel really confident that if this virus acts like every other virus that we know, once you get infected, get better, clear the virus, then you will have immunity that will protect you against reinfection. If this all turns out to be true, then it would suggest that reinfections are unlikely and that the cases in the news reflect testing sensitivity. However, SARS-CoV-2 is so new that we won't know for sure until we've found out just how protective our immune response to the virus is, and how long it lasts. Meanwhile, on Friday, the number of cases in the world was 1,193,324, deaths 64,270 and recovered 246,110. Number of cases in the U.S. was 306,507, and death 8,344. Number of cases in Spain was 124,736, and death 11,744. For China, where the virus is believed to have originated, listed 81,639 coronavirus cases and death 3,326, although the reliability of China's self-reported death toll has been questioned. Italy now has 124,632 cases and death 15,362. For much of the pandemic, it was the area hit the hardest besides China and has been under a strict lockdown for more than 2 weeks in hopes of preventing further spread.